Hello and welcome to Coffee with Dr. Carla. I'm Dr. Carla. This is Jessie, and we are very glad that you're here with us today. So our goal today is to talk about a few mental health related issues and hopefully start to end the stigma surrounding them. So Jessie, you and I met, I guess at a like expo-y type thing at a conference, and your areas of specialty are in the substance abuse world or substance use world. And so today I thought maybe we could start to talk about how, about the link between substance use and mental health, because, I mean, I see it all the time, but you have a slightly different perspective than I do.
Yes. So I think, first and foremost, there's, for anyone who's in our capacity, who operates in this field of mental health anywhere, is very familiar with how linked those things are. But there's probably a lot of people who don't realize that, teasing those two things apart from each other, mental health and substance abuse, it's not a thing. It's not possible. They're inextricably linked. And understanding that is really important because there are people who are struggling with both, who are convinced maybe for one reason or another that if they just need to fix one.
Right.
And then what that turns into is like a cyclical relapse situation because one of them is constantly setting off the other. So you can address the one that maybe you feel is primary, and then you think the other one's going to go away, or you're not acknowledging that it's there, and then here you go, you're back where you started from again. It's very hard to make progress.
Or you go after the one that has less stigma attached to it.
Sure.
Right? So, depending on how you grew up or what your culture was like, what carries a bigger stigma, going to see a therapist because of mental health, or going to get treatment, because you wouldn't tell people you're seeing a therapist for substance abuse or substance use. You'd say, I'm getting treatment for that, which sounds, I don't know, maybe nicer, easier than I'm seeing a therapist because I have mental health issues.
Right.
So, and I guess it just depends on...
Or vice versa.
Or vice versa, right?
Yeah, 100%.
Right. So if I don't admit that I'm, that I'm an alcoholic, or I have some sort of, pill issue, right? And actually, even as I say that, I can think of many people who have chronic pain issues, and if you think about the opioid epidemic, it's just, but my doctor keeps prescribing them, so why would I stop that?
Right.
I just have to work on something else, right?
Right. And like you said, like it could be depending on, and it also could be the way someone grew up. I've explained to my son, because I've been in recovery for 10 years. I got sober when my son was 10 years old. My mom was an alcoholic. All of my parents' friends drank very heavily. So I tell my son,
it's a generational thing.
You're going to have a very different idea of what drinking a lot is than I did. So somebody might think they're looking for help for their depression because they don't think they drink a lot, because drinking is so normalized to them that the amount of alcohol that they consume, while it's totally problematic, to them is like, well, no, isn't this what people do?
Everybody has a couple beers after work.
Right. Exactly, and it's not the drinking I need help with, it's the depression, and that person doesn't realize, like, alcohol is a depressant. Alcohol is causing consequences in your life that are making your life depressing, right?
Yeah.
And so that is, that's the thing too, is in working with the substance abuse primary population, again, so there's all of this co-occurring disorder stuff going on, but working within that, you realize how many people are misdiagnosed, because diagnosing somebody who's in active addiction is kind of crazy to me.
It is.
How do you know what's what?
That, and at least for me, when I'm diagnosing someone, regardless of why they're coming to see me.
Right.
Right? I have to go on the information provided.
Yes.
So,
correct.
if I ask, you know, what's alcohol like in your life? I have a drink or two every now and then.
Right.
Okay.
Yeah.
What does every now and then mean? You know, I don't know. Like whenever I'm with friends. Okay. Well then, you know, so I'm thinking, no big deal.
Right.
But then 2 or 3 sessions down the road, I realized
Yeah.
they're with friends every single day.
Right.
So the 2 or 3 drinks with friends is every single day,
Yeah.
right? Or
and by the way, those 2 or 3 drinks are 4 shots of whiskey apiece.
oh,
Because we
yeah,
didn't clarify that.
Right, right. So when I did my internship, one of my clients that I had, I was running a group, and so a client that I had in the beginning, he was on his way out, and I can't even remember what the exercise was that we were doing that day in group, but one of the other group members said something about like only one drink, and this guy goes, was that 6, 7, 8, 44 ounces? How big was it, right? And we were just, and everyone kind of laughed like, oh, I'm like, oh, that's an excellent question.
It's
So
actually
how big
a critical
was it?
piece of information.
How big was that drink? And he's like, right? Because, right?
Yeah, it changes the game entirely, because 1 glass of Miller Lite is different than a triple shot of rum in your Coke. You know, very big difference.
Well, right. And that's if you only have 1 shot of rum in your Coke.
Right.
Yeah.
Right. Exactly.
Right.
Exactly.
More people have a shot of Coke in their rum. So, yeah.
Correct.
Right.
It's for coloration purposes only, so no one notices that you're drinking straight rum.
Exactly.
Yeah.
Exactly.
Yeah. So that's one of the things that, you know, it's really, so then maybe you give someone, okay, here's a diagnosis of depression. We're going to put you on SSRIs. We're going to put you on this. We're going to put you on that. And then it doesn't help. You go, why isn't this helping?
Oh.
Well, because, so if someone...
I'm drinking while I'm taking medication.
Exactly.
Let's just start with that.
Let's start with that. And maybe you don't have clinical depression. If somebody would have given me one of the scales, one of the diagnostic tools for depression at the end of my alcoholism, I would have 100% have been diagnosed with depression. I don't have depression.
Yeah.
My life was depressing. I was drinking every day. I was losing everything. I was ashamed of myself. I mean, if you want to talk about feeling depressed, shame is going to get you there 100% of the time, right?
Oh, yeah.
When I stopped drinking,
express drink, too.
yeah,
Yeah.
100%. So
Yeah.
when I stopped drinking, I mean, but my issue is anxiety. It was there before I drank. It was there while I drank. It's still there now. But so I would have been misdiagnosed with depression had I been diagnosed during my active addiction, and then I maybe would have been started on a course of medication that I didn't actually need, when what I needed to do was address underlying trauma, which was
Right.
leading to anxiety.
Right. And
Right.
then the way you were treating your anxiety was through alcohol.
Self-medicating.
Yeah.
Right.
Yeah.
Right.
Which makes it really, really hard.
Yes.
Yeah. And it's one of those things that just goes around in circles. And so, yeah. And while my primary area of expertise is trauma, when I look at people with addictions, you know, I tell them this is a symptom of this trauma,
absolutely.
of this trauma, right?
Absolutely.
But it's not one that we can, you know, meditate away.
No.
We have to have very specific types of interventions
Yes.
to make it meaningful and lasting,
Yeah.
which gets to be, you know, tricky. But that's the benefit of having a network of people, and, you know, really encouraging clients to understand that I might be your primary therapist, but this one over here really understands addiction, so I need you to see that person as
Right,
well,
right.
so that we can work in conjunction with one another, so that you can get to the place where despite what people say, that everybody wants to get better. Nobody wants to live in misery.
No,
Right.
no. And I think one of the most important things you can offer those people is just understanding that it is a process. It's going to take time to kind of tease these things apart. Maybe you get the substance use under control, and then your trauma behaviors actually get worse for a while.
Yes, they will.
Because your medicine is gone now.
Right.
So helping people just understand that, like, this is not going to be snap our fingers, you're going to feel better, you're never going to be hypervigilant again, your emotions are going to be all over the place. But as long as you continue to move forward and address all of the facets of everything that was going on and start integrating, like, this path to wellness, you know, then you can have the recovery you're looking for. But it's a process.
I think that's a good piece of advice to end on, because Yeah. I think when people finally feel like they're desperate enough to ask for help, and then they feel defeated when it's not instantaneous.
Yes.
So yeah, that's a great reminder that it is a journey and it is hard.
Manage your expectations.
Exactly. So remember, you can change your thoughts, discover your potential, and transform your life by focusing on your overall well-being. So until next time, continue working on being the best you possible. Bye.